A soldier lies in the mud. His leg is split open to the bone. The battlefield surgeon walks past him. There is nothing to be done. Then a monk kneels down. He opens a small leather satchel. Inside, a jar of dark honey, a bundle of dried herbs, a strip of linen soaked in something amber-colored. He works in silence, methodically, without panic. 3 weeks later, that soldier walks out of the monastery infirmary. No amputation, no fever, no rot. The surgeon never understood how, but the monks had been doing this for 500 years. Inside Benedictine and Cistercian infirmaries, wound survival rates were not matched by mainstream medicine until the late 19th century. Not luck, a system, plant-based, precise, ruthlessly effective, buried when wound care became profitable. Until today. Stay with me. Number 6 is the wound remedy. Military surgeons quietly reintroduced after a 100-year absence because nothing they developed outperformed it. Number 10 closes infected wounds in 72 hours, confirmed by a 2019 clinical trial. And number 14 is growing as a weed in your garden right now, regrowing human skin since the Roman Empire. Number 1, raw honey. The monastery's surgical dressing. The wound is infected. The flesh around it is swelling. The smell has begun. In a modern hospital, this means intravenous antibiotics and a wound care team. In a 13th century monastery infirmary, it meant one thing: raw honey, applied directly, packed into the wound, sealed with linen. Cistercian infirmary records document honey as the primary dressing for infected wounds and burns. Applied without exception. Honey creates a hyperosmotic environment, pulling fluid from bacteria, killing them. It releases hydrogen peroxide continuously. Contains defensin 1, killing a broad spectrum of bacteria. Its pH between 3.2 and 4.5 makes survival impossible for most wound pathogens. Manuka honey is now used in NHS hospitals for antibiotic-resistant wounds and confirmed to outperform standard dressings in healing time. The monks packed it into wounds 8 centuries ago. Number 2. Garlic poultice, the antibiotic bandage. In the monastery infirmary, an infected wound that had resisted other treatments received one intervention above all others. A garlic poultice, raw garlic, crushed, mixed with oil to protect surrounding skin, applied over infected tissue and bound with linen. Left for hours. Replaced daily. Records from the Benedictine infirmary at Canterbury describe this protocol with precision. The monks noted which wounds responded fastest. Adjusted timing by severity. Empirical wound science. 8 centuries early. During World War I, British military surgeons ran out of antiseptics. They applied garlic juice to wound dressings as an emergency substitute. Infection rates dropped. Amputations were avoided. Lives were saved. Allicin released when garlic is crushed is lethal to Staphylococcus aureus, Streptococcus, E. coli, and numerous wound pathogens. It penetrates biofilms that bacteria build to resist antibiotics. A head of garlic costs 60 cents. The monks knew. It took 2 world wars for mainstream medicine to reluctantly agree. Number 3. Plantain leaf. The wound herb growing in your driveway. Stop reading for a moment. Look outside. Do you see a low-growing plant with broad oval leaves, growing in pavement cracks or at grass edges? Plantago major. Common plantain. Medieval monks called it the mother of all herbs. Not for complexity, for reliability. Always within reach, always free, always effective. Chewed fresh leaves, applied as pulp, directly to wounds. Poultices for infected cuts, salves for splinters, compresses for burns. Plantain contains aucubine, anti-inflammatory and antimicrobial. Allantoin, stimulating new tissue growth. mucilage, creating the moist wound environment essential for healing. Tannins forming a protective layer while deeper healing proceeds. A 2015 study confirmed plantain extract accelerated wound closure. The monks concluded this in the 10th century. Without a journal. Number 4. Comfrey the Bone Knitter. The monastery called it knitbone. That name is not folklore. It is a clinical description. Symphytum officinale. Comfrey was the monastery's primary treatment for wounds that involved deeper tissue damage, fractures with skin involvement, deep lacerations, joint injuries with surface wounds. The monks made comfrey root poultices, comfrey leaf compresses, and comfrey-infused oils applied to wounds in the final stages of healing to minimize scarring. Comfrey contains allantoin in higher concentrations than plantain, accelerating cell division and tissue regeneration. Plus rosmarinic acid, reducing inflammation, and choline supporting cellular membrane repair. A 2012 trial found comfrey root cream significantly accelerated healing, faster reapoptosis. The monks called it knitbone because they watched it knit tissue together. Pharmaceutical companies have patented the extract. The root costs almost nothing. Number 5. Beeswax salve, the moisture-locking seal. The monastery's wound care ended with sealing. Beeswax from monastery apiaries, combined with olive oil, was the monk's wound sealant. Applied over a treated wound, it created an occlusive barrier maintaining moisture, excluding bacteria, allowing gas exchange. This is the principle of modern occlusive wound dressings, hydrocolloid, and film dressings used in contemporary wound care. The monks developed it from natural materials because they observed that sealed wounds healed faster. A 2003 study found beeswax-based preparations comparable to petroleum jelly in antimicrobial efficacy with superior moisturizing properties. 2 ingredients, less than $10. Used in monastery infirmaries for 1,000 years. Number 6. Maggot therapy. The treatment military surgeons brought back. This is the one that shocks people. But stay with the history, because the science is extraordinary. In monastery infirmaries, caring for battlefield casualties, monks observed something counterintuitive. Wounds colonized by certain fly larvae healed faster, with less infection and less tissue loss, than clean wounds. They called it a mercy of God. They documented it, and they sometimes deliberately introduced larvae into gangrenous wounds when other treatments failed. American surgeon William Baer noticed in World War I, monks had noticed 7 centuries earlier. Soldiers with maggot-colonized wounds had dramatically better outcomes. He formally studied maggot debridement therapy in the 1920s. Today, maggot therapy is FDA approved for chronic infected wounds, resisting all antibiotics. Sterile larvae prescribed like drugs for wounds that would otherwise require amputation. The monks documented it, called it providential. Here is what has happened so far on this list. 6 treatments. All monastery, all confirmed. Most costing nothing. Your emergency room charges $2,000. The monastery charged nothing. And for the critical metric patient survival, the monastery held its own until the 1940s. Leave a comment. The wound care industry needs this hidden. Number 7. Turmeric paste, the golden anti-infective in monastery medicine of India and the Arab world, connected to Europe through trade routes. One wound treatment was standard first aid for 2,000 years. Fresh turmeric root, ground to a paste. Applied directly in Tibetan infirmaries, combined with ghee and pressed into deeper lacerations. Arab medical texts, translated into Latin, brought this knowledge to European monasteries by the 12th century. Curcumin inhibits NF-κB, the master inflammatory molecule, kills Staphylococcus and E. coli, promotes fibroblast migration, and reduces scar formation. A 2016 biofactors review concluded curcumin accelerates all 4 phases of wound healing simultaneously, from a root costing $2 per pound. Number 8. Thyme oil, the airborne wound protector in monastery infirmaries during plague years. Monks burned thyme continuously. The wards filled with aromatic smoke. The patients breathed it. The wounds were exposed to it. At the time, this was understood as purification, spiritual and physical simultaneously. The science behind it arrived 700 years later. Thymol kills Staphylococcus aureus, Pseudomonas, and Candida on direct contact. Currently used as a surgical instrument, preservative, antiseptic mouthwash ingredient, and wound irrigation component in a dozen countries. The monks burned thyme and called it prayer. The wounds stayed clean. Number 9. Aloe vera, the monastery desert garden secret. The infirmaries of monasteries in southern Spain, Sicily, and North Africa maintained aloe vera as urgent priority. Not for decoration, for burns. Fresh aloe gel applied directly reduced pain immediately, prevented wound desiccation, created a barrier against infection, and accelerated new skin cell growth across burned surfaces. A 2007 systematic review found aloe vera reduced burn healing time by 9 days compared to conventional dressings. From a plant that costs nothing to maintain. Number 10. Calendula, the monk's wound flower. Every monastery garden contained calendula, the bright orange pot marigold. Not for its color, for its consistent ability to close open wounds. Calendula was the monastery treatment for slow-healing wounds, the kind that cleaned up but refused to close. It contains triterpenoids stimulating fibroblast production, cells building the structural scaffolding of new tissue, polysaccharides activating macrophages that clear dead tissue, and oleanolic acid reducing the inflammation that stalls chronic wound healing. A 2013 trial compared calendula ointment to petroleum jelly in post-surgical patients. Calendula showed faster healing, lower infection rates, and better cosmetic outcomes. About a flower monks grew in every medicinal garden for 1,000 years. Number 11. Yarrow, the battlefield stauncher, Achillea millefolium, named for Achilles, who used it to staunch his soldiers' wounds. Not mythology, documented across 2,000 years of military wound care, including the Knights Hospitaller. Yarrow contains achillotin and accolane, contracting blood vessels and accelerating platelet aggregation, stopping bleeding faster than unaided clotting. It also contains antimicrobial flavonoids and analgesic camphor, simultaneously stopping bleeding, killing bacteria, and reducing pain. Hospitaller monks carried dried yarrow in battlefield kits and pressed it into wounds to stop hemorrhage. Modern emergency preparedness communities have rediscovered it for exactly the same reason. It grows wild across Europe and North America, and it stops bleeding. Number 12. Pine resin. The monastery's surgical adhesive pine resin. The amber sap Cistercian monks collected from surrounding forests, the same substance trees produce to heal their own wounds. The monks dissolved it in oil and applied it as a liquid sealant, hardening on contact, a natural adhesive for lacerations that would otherwise require stitches. A 2014 study found Norway spruce resin, common to Central European monastery forests, active against all tested wound pathogens, including MRSA, the bacteria that defeats modern antibiotics, defeated by tree sap. Number 13. Lavender oil, the cleansing rinse. The monastery cleaned wounds first. Not with expensive saline solutions, with lavender-infused water used to irrigate fresh wounds before any other treatment. Lavender contains linalool and linalool acetate with antimicrobial properties. Critically, it also contains analgesic compounds, making wound cleaning tolerable without anesthesia. In a time without painkillers, that was the difference between a patient who cooperated and one who did not. A 2015 study confirmed lavender oil active against Staphylococcus and E. coli at dilution concentrations. The combination costs less than $3. Number 14. Usnea lichen, the ancient wound antibiotic. This is the one that has been healing wounds since the Roman Empire. Usnea grows on tree branches across Europe and North America, a symbiotic organism. Part fungus, part algae, unchanged for millions of years. Medieval monks packed it directly into wounds. Records from the 10th through 15th centuries describe it filling wound cavities while preventing infection. Usnea contains osnic acid, one of the most potent natural antibiotics known, effective against Staphylococcus, Streptococcus, and Mycobacterium tuberculosis. Now investigated for antibiotic-resistant infections, because osnic acid works through a different mechanism, making cross-resistance essentially impossible. The monks packed it into wounds, because wounds dressed with Usnea stayed clean. The Romans did the same. The knowledge predates any pharmaceutical company by 2,000 years. Number 15. The Monastery wound-closing ritual. Stillness, steam, and silence. We end not with a plant. We end with a practice that made all the other treatments work. In the monastery infirmary, a wounded patient was placed in a quiet cell. The room kept warm with herbs on braziers. The patient kept still, fed simple food, removed from stress and noise, monitored by a trained monk who adjusted treatment as healing progressed. What the monks were creating without the immunology was the optimal wound healing environment. Warmth delivers immune cells. Stillness prevents disruption of forming tissue. Reduced stress lowers cortisol, which otherwise suppresses immune function. Nutrition provides raw materials tissue construction requires. Modern wound care science calls this the wound healing environment. The monks achieved it with a warm room, quiet walls, and simple food. They replaced this with products in boxes and professionals charging by the minute. The monks charged nothing. Their wound survival rates tell a story the industry would prefer you never read. Share this, subscribe. The archive goes deeper.